Afternoon. This is Facebook Live, and I'm Joanne Conroy, the CEO of Dartmouth-Hitchcock and Dartmouth-Hitchcock Health, and I'm here with Aimee Giglio, our Chief People Officer. Now, I know we're starting a little bit early. I want to remind people that you can actually send questions in through the Facebook post, through the news feed. And just go ahead and post your questions, and we have people here that are monitoring Facebook and will hand us the questions so we can answer them for you. We want to be really relevant to the many viewers we have out there. Again, I'm Joanne Conroy. I'm the CEO of Dartmouth-Hitchcock and Dartmouth-Hitchcock Health, here with Aimee Giglio, our Chief People Officer. So Aimee, I want people to get to know you a little bit. I know everybody knows you as the head of HR, our very important people function, but talk a little bit about your family. I know your husband has a kind of interesting business.
He does, yes. So I live in New Hampshire. I live in the New London region, and married and have one son. And you're right, my husband does have a catering business, a barbecue business to be specific. He left his job probably about 3 years ago to start a catering company, and so enrolled a 30-foot food truck or mobile kitchen to be able to do that. And it's been a big success in our region, and actually has morphed into a business partnership that will be moving into building a restaurant.
Oh, wow.
In that region. So we're really excited about that, and something that it's nice to see someone take their hobby to be entrepreneurial with it and really make it a business.
Yeah. So having spent a lot of time in food service,
yes.
When I was going through college, the demands are different. It's not a 9-to-5 job during the week. In fact, often it's nights and weekends. So how do you guys manage that with your son, Jack, who's 5, 6?
He's going to be 5, yes.
Okay.
Yep, he'll be 5 this year. I always say it takes a village, and so we have, tremendous family and friends that are around that really help us with it. But certainly during the day, during the week, he has our son during the week for the most part, and on the weekends I'm, have full duty because he's doing weddings and big catering events. So we make it work, but definitely is a balance.
Now, your husband has a barbecue food truck.
Yes.
That's correct. So what's your favorite sauce? Carolina mustard sauce, Memphis spicy sauce?
Yeah, so it's funny you ask that because I actually am a little bit done with eating barbecue all the time. But my father lives in North Carolina, so I love that vinegar-based mustard sauce.
Mm-hmm.
And my husband puts out the full spread in terms of the Carolina sauces and Texas sauces. So he's got a lot of homemade ones that he's adapted over the years through travels that we've done around the country on just eating barbecue.
Whenever you go to a different city, do you go to a barbecue restaurant?
He tries to stake it out, yes. And I try to prevent it if I can.
So how about your favorite side?
So I would say my favorite side is he makes what's called a squash casserole, which is a yellow summer squash. That's something that we don't really have here in the the northeast, but is very popular at other parts of the country. And it's become such a staple in our family that actually my family asks that AJ bring it to Thanksgiving dinner, even though it's not a traditional side, but something we really enjoy.
Yeah. What do you do with leftover barbecue?
We give it away. I don't know if that's kosher or not, but we give it away and give it to friends and family, and something that people really enjoy. So
yeah, well, great.
Yeah,
that's great. So let's talk a little bit about human resources, or really investing in our people.
Yeah.
Most organizations do have a HR department. In fact, it's kind of one of the key leadership positions in every single organization. Describe a little bit how that's different in healthcare in terms of HR, and what the different buckets of work are in HR.
Yeah. So human resources has really evolved, I would say, over time in terms of the way it was developed in the Industrial Revolution to where we are present day. And HR has a variety of functions that it performs, and some of those we would consider sort of the traditional functions, benefits and compensation, employee relations, and just the whole management of sort of bringing in talent, hiring, and developing them through their course of their career. In healthcare, I would say we're particularly different and unique in that we are a provider and an employer. And so when we think about some of the benefits that we offer, we really consider what does that mean with our own employees seeking healthcare for themselves and their families, as well as what we're delivering on the patient end. And so we have a very close partnership with our wellness programs as well as our provider side of the house that fosters that unique relationship and helps us to tailor benefits and reward programs that really meet the needs of a changing healthcare workforce.
Yeah, people probably don't realize that you also have our health insurance
Yes.
kind of under your umbrella. So you actually have to manage that and actually maintain the privacy of individual employees, because I know that's an aspect of their care that they really want to have separate from their employer. So how do you manage that? What are the kind of challenges and pitfalls that people have to navigate through?
Absolutely. Well, we hire a third-party vendor or firm to help manage all of our health insurance. So we don't do that in-house here. But we partner about where we want people to seek care and how we can help people navigate care for themselves and their families.
You were at other companies before you came to Dartmouth-Hitchcock. So what's the experience that you maybe had being an employee at another company, and how do you actually translate that to how you would like to fashion benefits here? Because we're all kind of a product of our experiences when we actually come into leadership positions.
Absolutely. I would say being at other organizations, I've worked in both public, private, as well as the corporate environment, and understanding what types of reward programs that they provide employees. And there's quite a diversity in what's offered out there. I would say, what we try to do here in healthcare is to be as innovative as we can be to meet the needs of our population. And being in a rural area of the country gives us some unique challenges and benefits to designing programs that provide a true reward to people to come and work. When I think about other organizations I've worked at, what is the value proposition, or what's the brand? Why would you want to work there? And how do they create that sense of belonging and become that employer of choice? And that's something that we're consistently working on in HR to be able to deliver that for our own employees here.
So what's the most unique kind of offering that you've seen in the employer-employee relationship, like the most unique benefit that you've seen across the industry?
That could be a trick question.
Oh, yeah.
I mean, a lot of organizations, they focus on, affordable child care, or some of the unique options around pet insurance, or subsidies or time off to go and volunteer in the community. And so it's a community-facing benefit and not just an individual sort of how do you take care of yourself and your family, but what are you bringing back to your community? So it runs really the full gamut, and I think that in times of workforce shortage, which is a time that we're in now, the unemployment rate in our region is extremely low and one of the lowest it's been. Employers are really getting creative with what they offer to really be an attractor. And how do you both attract and then retain the employees as you bring them in your organization?
When you actually think about attracting employees up to Lebanon, even though I know you recruit employees for the entire health system, are there particular advantages and challenges getting an employee to actually come up and work in Lebanon versus Manchester or Nashua?
Yeah, I think it depends on the type of position that someone is applying to. And so when you think of our providers, being an academic health center or health system is a big attractor. I think oftentimes when folks come here, some of the barriers or challenges around housing, transportation, and even for our local workforce and people that we're recruiting locally, to get them to come and stay and live in this region can be a challenge because of those pieces that are really essential to keep someone in the area. So housing, transportation, childcare.
Yeah, we don't really have a lot of millennium-friendly housing around here, meaning if people want to work and live in an area that they can kind of walk to work, that's difficult. The mixed-use retail housing, we really don't have a lot of that here.
Right.
So what are the things that we can actually do for millennials, do you think, to attract them to a place like this?
I think a lot of it resides around amenities. So making things easy and quick and local to obtain, whether that's anything from the food that we eat, the creative environments, coffee shops, places with Wi-Fi, but also, really looking at how the types of housing that's offered. We've done a lot of work to look at, is it micro units, or in this particular region, we know that 1 and 2 bedroom apartments are really hard to find. And so as you think about someone coming from an academic environment, maybe school, or coming from school to work, where do they live and thrive? They're going to start in that apartment environment, and that's something that we're really challenged by in this region.
Yeah. It's a great region for bringing up families, great school systems, but not always the first choice for millennials, probably. And that's where a lot of our nursing staff and a lot of our support staff may actually come from in the future. I know we're in this almost zero unemployment situation across the state. And healthcare is probably more vulnerable because we have a need to put patients and people at that interface between the health system and patients. Talk a little bit how you actually take a system view for recruiting people. I know that you've thought a lot about how do we actually blend how we're employing people and how we're delivering benefits across the organization, and it's not that easy to do because every organization is different. So talk a little bit about how you look across our entire health system, and do a little dreaming about what would you like to see happen over the next 3 years.
Yeah, so I think it sort of relates to your question about what is HR and what are some of the functions that HR provides. And one of the one of the attributes of HR in terms of its evolution is really becoming a strategic partner. So partnering with our businesses, and we do have for Dartmouth-Hitchcock Health locations across our state that have different cultures, needs, and they're attracting different talent to their area. So if you think about like our Nashua Clinic, for example, it's a much more competitive environment to Boston than it might be in this region for certain roles. And so really working and partnering with our local business leaders within the organization to say, what is it that we're trying to attract? How do we retain in a particular area? Coming with creative solutions to do that. And really partnering to see how do we keep people in the organization and keep them engaged through development and learning programs so they really can make a career at Dartmouth-Hitchcock. When we think about the system and the variety of locations, we say dream, my dream is to say to a candidate, really, you can work in many different environments. You can work in a very high-paced environment. You can work in a clinic environment. You can work in an acute hospital environment. And that when you think of healthcare, it's not just healthcare workers that we're attracting. So a lot of what we do is customer service-based, is hospitality-based. And so we have an opportunity to bring in people with different backgrounds into our organization and really give them an environment to come and thrive in. As we, from a human resources perspective, as we integrate some of those foundational aspects like recruitment. We can demonstrate to candidates where they can work within our system, and then as a centralized function, be able to show growth and career opportunities throughout. So I might start in a particular location and move to another based on where I am with my career.
Yeah. Sue Mooney actually, I think a week or 10 days ago, talked about the fact that she got some feedback from some of her employees at Alice Peck Day, and they felt like actually joining the health system offered them the opportunity to probably move up a career ladder a little bit faster, maybe in a different location, and they felt that actually allowed them a greater kind of breadth of career opportunities. When you look 3 to 5 years out, how much moving around do you think people will do?
I think it will be interesting to see. We are on the cusp of developing what those career pathways will look like. And so 3 to 5 years from now, being able to really describe to someone where they can go within our system and within our system members will be of value, I think, to employees. We're trying to mitigate or reduce the barriers to being able to move around and provide those development opportunities, so that if we have a situation where maybe one environment is not the best, or someone would like to move, whether that's growing or actually cut back, maybe go part-time, we'll have those options depending on where everyone is in their career.
Talk a little bit about how we work. I know you said we had employees in 20 different states, so do we have people telecommuting already? That is kind of changing the way we work. We know that there are a lot of jobs that can almost be virtual for most of the time. Talk a little bit about how you see that evolving in healthcare.
Yeah, flexible work schedules and remote workforce is definitely the future, and I think here for a lot of roles, especially if you think about some of our technology roles where you can really work anywhere. You can work from home. And we might not be able to or need to attract talent to come to this particular area of the country if they possess those skills and can work in their own environment. And so we have been thinking really creatively about how do we source for talent and employees in particular positions that can warrant either a flexible schedule or remote working, and eliminate some of the barriers to being able to do that. So we do have positions that are in different parts of the country that I would say maybe 10, maybe 15 years ago, we wouldn't have thought that we would have either have been or have needed to be progressive in that area. Especially when you think of healthcare, you almost think of brick and mortar, but that's just not the way for a lot of our functions.
Yeah. And actually, if you think about what we've been doing in telehealth, you can actually see that the physician even doesn't always have to be at the bedside in order to affect care. And I know that they're actually trying to do that within the health system now for ICU care. So it's changing how we think about how we do our work. Talk a little bit about your background, because you are a social worker. So that was your clinical background that you entered into being chief people officer with. So talk a little bit about that journey.
So my evolution, I guess, in terms of my career, I did start in social work. I worked as a case manager in a community mental health center and loved that work, doing direct care. I learned a lot. I worked as an internship when I was in college at University of Vermont Medical Center, which was Fletcher Allen at the time. And that really gave me a feel of wanting to work in healthcare, although I would say from the time I graduated with my bachelor's, my career took a couple twists and turns and ended up going back to school for business. And that's how I blended both social work as well as business and HR to really step foot into human resources. But I always wanted to come back to healthcare. And so when I started at Dartmouth-Hitchcock, coming on almost 9 years ago, I felt like I was coming home. And it gave me an opportunity to be in an environment where I know I make a difference every day, both in the lives of patients and in the lives of employees, and can blend those skills that I learned when I was in direct care and be around people who are delivering that today with human resources.
So we have a question, and I I want to remind people that this is Facebook Live, and I'm here with Aimee Giglio, who's our Chief People Officer, Head of HR. And if you want to post questions, as somebody has just posted a question, all you have to do is post it on Facebook on our page. What's the most sought after position at Dartmouth-Hitchcock?
Oh, that's a great question. I think that...
My job? Your job?
Well, I think that depends on your perspective in terms of sought after. I think that all positions at Dartmouth-Hitchcock are important to the delivery of patient care. When we think about some of the shortages that we're having, I see that mostly in the physician and in nursing space. But there are some really fun roles at Dartmouth-Hitchcock that you may not even think of. Like the people that are putting on this Facebook Live and doing communications and marketing that give us an opportunity to have reach as well. So that's a really hard question.
Yeah. Actually,
what do you think?
As I think about some of the jobs that I find particularly rewarding, I think the people of the Jack Burns Center are really driven by kind of their mission. Most people probably have had an experience with end of life with their families, so they feel like they can really relate to the needs of the families and the patients. I think about the CHAD, people
Working
in the infrastructure, those kids, they love kids. I mean, that's a reason why they come to work every day, is to really improve the lives of those children that need their care.
Right.
But you know what, when I was congratulating Liz Erickson for their gynecology high ranking in U.S. News and World Report, you don't actually, you don't succeed in that way without having people that really love their job. And all you have to do is go to the labor and delivery unit, the birthing pavilion, and meet the nurses and the midwives and the residents and physicians to realize, how much they love their job. And in fact, I even got an email from one of our employees that was here for a performance review on Saturday, and had the opportunity to help an elderly couple that was totally lost. And she wrote me this wonderful email really talking about how it really made her day and it kind of connected to purpose. So you can see that there are many jobs. It's probably less about the job and more about how it really makes you feel when you walk out the door.
Absolutely.
So
I would agree with that 100%.
I could see you in other jobs though.
Absolutely. I think I would, one of the things that we've been talking a lot about is how do we job shadow and look at other roles and gain a greater appreciation for what those roles are. Both doing that with leaders and some of our rounding, as well as with employees as well. So
what have you learned from your rounding?
I've learned, where I don't even know where to start. It's been an incredible experience to learn about the different functions within our organization and what they actually do. So it's one thing to know about a particular department or unit, and it's another to walk side by side with one of your colleagues and have them show you. And there's a lot of complexity to what we do, especially in the patient care areas. I've learned a lot about research and at the clinical trials office, and seeing what they do and how they manage those trials that we're doing. So a variety of things, but it's been a very rewarding experience.
It was a little bit of a heavy lift to get the some of the senior team to round, but they've all really enjoyed it. To a person, I think it's affected their connection to what we do, and really has educated them about the complexity of what we do here.
Yeah, of all roles.
So it's another question. Dartmouth-Hitchcock has done a great job with the new apprenticeship programs to address workforce needs. Yeah, you guys really have. What are the other ways that you're thinking creatively in order to address workforce issues?
Yeah, that's a great question, and a program that we're very proud of. Sarah Courier has run that program with her team and delivered a lot of training and education. We're really, right now, we're looking at how to expand on those programs to different positions. Also looking at our diversity and inclusion efforts, and looking at segments of our population that we really want to attract into our workforce.
Yeah.
So you and I went recently on the boss lift, if you will, for veterans, but there are other organizations and populations out there that we're looking to connect with, whether that's youth engagement in the high schools, I would say even in middle school, in giving a career, and also with some of our retiree population in terms of coming back to work and working part-time.
Right.
So it's really thinking creatively about the full gamut of people and how do we attract people to our organizations.
So a lot of people might not know what Boss Lift is.
Yes.
So Aimee and I last Thursday had the opportunity to go on an Air National Guard experience where they take leaders across the state and show them what Air National Guard does.
Yes.
Why don't you tell them what we did?
So we ended up going on an Air Force. It's the KC-135 plane, and
It's
actually
like a flying gas tank.
it's a refueling mission.
Yeah.
And we get to see them refuel, I think, about 4 fighter jets off the coast of
New
Cape
Jersey?
Cod. Yeah.
In the middle of the air.
And it was impressive. I think, what we learned there is we have many active and retired service members that are in our workforce working for us and helping our patients. And so it's really neat to see what they do when they go on guard duty and the impact that they're making in those roles as well.
Talk a little bit about some of our recent efforts to really address gender and racial equity in terms of how people move up in the organization. I was very impressed with your approach to 2 leadership positions that we had in in our administrative infrastructure.
Yes.
So talk a little bit about what you did, because I think it's really great.
So what we've done is just taken a look at how do we increase diversity in our workforce and try to help leaders as they're selecting candidates to remove or limit unconscious bias. And so one of the ways we did that with those particular searches is we actually removed the name of the individual so that the leaders and the selection team reviewing the resumes couldn't tell what gender the person was coming through. We're looking at other ways to be able to help our leaders through training and education as well about unconscious bias, and pull from organizations that do this in terms of their diversity efforts to help our leaders get a greater appreciation and awareness of it.
Yeah, I was impressed though that not only does that remove kind of gender bias, but also probably racial bias. And you said that you actually got some candidates in the pool that you're not sure that they would have actually come into some of your finalist pool if you hadn't done that.
Yeah,
So,
we may not have known, but it certainly did give us a great pool of candidates of which we made a selection from. So.
Yep, outstanding selections. They were announced last week,
Absolutely.
So it's great. Is there anything that we haven't talked about that you really want to share with the Facebook Live audience about what we're doing around investing in our people?
I would say, Dartmouth-Hitchcock Health, in terms of all of our organizations, is a wonderful place to work. We're working very hard now to look at how do we sort of refresh our benefits programs and our compensation programs, as well as our training and development to attract and retain people to come and work here. It is one of those places when you get out of bed every day, you know that you're making a difference and can feel proud about the place that you work, but also the colleagues that you work with. We have a great group of people that are really dedicated to our mission and working toward our vision. So proud to work here and to be able to continue in this role.
Yeah, I would say that when we talk to employees, they say they really love what they can do for patients, but their respect and their connection to the people they work with is very, very powerful. And when we go on rounds, we know that people say they love it because of the teams that they work with.
Absolutely.
So one last question. Is there anything Dartmouth-Hitchcock can do to help employees to encourage their friends and children to look at job opportunities here to return to the area? Family is actually a pretty powerful draw. They're right.
is.
People do have kind of a homing pigeon mentality to kind of come back to where their family is. And so what are we doing to actually get the word out for people to reach out to their extended families?
I think that's a great question, and we do have the Dartmouth-Hitchcock Careers website, and our locations have their website that has the job postings that are out there. We also post on LinkedIn as well as our Facebook page to say here are some hot jobs or new jobs that have just come on the market that we're looking to recruit for. And so I would encourage anyone to pay attention to those websites as we seek to post. You know, we are in the schools and trying to get out as well, so we host job fairs and we're at different conferences as well to promote the jobs that we have, but certainly based on our websites and calling in to our line, we can help to help someone navigate and see what jobs might be out there for them.
There are a lot of families that work here. I know that you have to be pretty careful that sometimes they don't all have the same last name.
That's right.
But you just assume that everybody is related to somebody else within the organization. And that an interesting concept to see if we could actually build on that. Why did you come back to New Hampshire?
I came back because I think we mentioned family being one, but also just it's a beautiful place to live and raise a family, and had an incredible opportunity to stay and come and work. So I feel like you know, it's definitely coming home, but also coming home and making a difference in a place where you can add purpose.
Yeah, yeah. And I know that often when you go out in the community, people don't recognize you except for the fact that you're married to the barbecue guy.
Yes.
Yeah.
Yes.
It's nice to have that level of anonymity.
It is.
Yeah.
It was like, I work at Dartmouth-Hitchcock too, but we also have barbecue. So no, it's great. It's great. We have a great community.
All right, great. Well, thank you so much, Aimee, for spending the time with us. And thank
Thanks
you,
for having me.
everybody, for tuning in to Facebook Live. Have a wonderful day.
Thank you.